So what's IUI all about? Well, IUI involves placing washed and concentrated sperm directly into the uterus around ovulation time. This shortcut means the sperm have a shorter journey to the egg, boosting the chances of fertilization. Now, when is IUI typically recommended? It's a go-to option if there's male factor infertility like low sperm count or motility. It's also helpful if there are cervical issues, unexplained infertility, or if you're using donor sperm. Plus, it can be combined with ovulation-inducing medications for those with ovulatory disorders. Let's break down the procedure steps. First, there's optional ovarian stimulation. Here, medications like clomiphene or letrozole may be used to stimulate egg development. Your progress is monitored via ultrasound and blood tests to track follicle growth and hormone levels. Next, the ovulation trigger. A hormone injection, often HCG, is given to induce ovulation when follicles are ready. Then comes sperm preparation. The sperm sample, whether from a partner or donor, is washed to remove seminal fluid, isolating the most motile sperm. Now, the insemination itself. A thin catheter is inserted through the cervix into the uterus and the prepared sperm is deposited. This quick 5-10 minute procedure involves minimal discomfort. After the procedure, you'll rest briefly and then can resume normal activities. Just avoid vigorous exercise for a day or two. What about success rates? They typically range from 10 to 20% per cycle. Factors like age, fertility diagnosis, and whether ovarian stimulation is used can impact this. Success is higher in women under 35 and couples with unexplained infertility. While IUI is generally safe, there are risks and side effects to be aware of. Multiple pregnancies can occur, especially with fertility drugs. There's also a rare risk of ovarian hyperstimulation syndrome, or OHSS. Mild cramping and spotting post-procedure are common, and infection is very rare. Aftercare involves a pregnancy test 10-14 days post-IUI. If the first cycle isn't successful, cycles can be repeated. Typically 3-6 attempts are recommended before considering IVF. Speaking of IVF, how does IUI compare? It's less invasive and costly than IVF, but has lower success rates per cycle. IUI doesn't involve egg retrieval or laboratory fertilization. IUI can be a first-line treatment for many fertility challenges and offers a less invasive pathway to conception. Consulting with a fertility specialist can help tailor the approach to your unique needs. Thanks for watching. If you found this helpful, don't forget to like and subscribe for more insights on fertility and health. Stay hopeful and take care.